Welcome. Today, we're exploring the important work of Dr. S.K. Singh and the World Health Organization's guidelines on drinking water quality. We'll also look closely at how reverse osmosis systems fit into ensuring safe, clean water for everyone. Let's dive into what makes water safe to drink and how technology helps us get there. Let's start by looking at why WHO guidelines matter so much. The World Health Organization sets these internationally recognized standards to protect public health, focusing on drinking water safety. Their approach isn't about one-size-fits-all treatment. It's a risk-based framework that adapts to different situations. Reverse osmosis, or RO, is one technology that can help meet these goals by removing a wide range of contaminants when done right. Today, we'll explore how WHO's approach works, where RO fits in, and why water safety plans are key. We'll also touch on health and regulatory factors, using real-world examples like treating fluoride-rich groundwater. The World Health Organization's approach to safe drinking water rests on three core components. First, health-based targets. These set clear goals to protect us from harmful microbes and chemicals, using risk-based standards. Next, the Water Safety Plan, which is all about identifying hazards, assessing risks, controlling them, and keeping a close eye with continuous monitoring and quick fixes when needed. Finally, independent surveillance ensures regulatory oversight, checks compliance, and tracks public health outcomes. For example, a bottled water company might spot a membrane failure risk, test regularly, and document fixes as part of their safety plan. The World Health Organization doesn't recommend one single water treatment method for every situation. Instead, the best choice depends on several factors, like the quality of the source water, what contaminants are present, the health risks involved, and the local environment and operational capacity. Reverse osmosis, or RO, shines when dealing with high total dissolved solids, excess fluoride, nitrates, heavy metals like arsenic and lead, salinity, and some pesticides. For example, a coastal community facing seawater intrusion might use RO to lower salinity and meet drinking water standards. Let's talk about what the World Health Organization says regarding demineralized water, water that's had most of its minerals removed, often through reverse osmosis. RO removes not just contaminants, but also naturally occurring minerals like calcium and magnesium. WHO points out that while drinking water can add to our intake of these minerals, the main source should always be a balanced diet. Very low mineral water isn't inherently unsafe, but it's important to consider the bigger nutritional picture. Sometimes, adding minerals back in can improve taste and stability, making the water more acceptable to consumers. When it comes to water safety for reverse osmosis systems, there are several critical control measures we need to keep a close eye on. These include pretreatment monitoring, checking membrane integrity, and keeping tabs on conductivity and total dissolved solids. Routine sanitization and preventive maintenance help us stay ahead of problems. Laboratory testing and thorough operator training round out the essentials. We apply the World Health Organization's risk-based approach to identify potential hazards like membrane fouling, rupture, microbial contamination, biofilm buildup, incorrect chemical dosing, and even storage tank contamination. Staying vigilant on these fronts keeps water safe and systems reliable. When we talk about drinking water quality, the World Health Organization focuses on three main groups of parameters. First, the chemical contaminants, things like arsenic, lead, nitrate, and fluoride. These can be harmful even in small amounts. Then there's the microbiological side, where the presence of E. coli or other pathogens must be zero to keep water safe. Finally, operational parameters like pH, conductivity, and turbidity help us monitor water quality in real time and ensure treatment processes are working effectively. Beyond the World Health Organization, many countries build their own regulations based on WHO principles, adapting them to fit local needs. For example, India follows standards set by BIS under FSSAI, while the United States relies on EPA and FDA rules. The European Union has its Drinking Water Directive, and the Codex Alimentarius provides international food standards. Alongside these, good manufacturing practices are essential. Things like process validation, maintenance, calibration, and thorough documentation. These ensure quality and safety every step of the way. Let's clear up some common myths about drinking water, especially around reverse osmosis, or RO systems. First, the WHO doesn't say everyone should only drink RO water. The best treatment depends on where your water comes from and the risks involved. Some say RO water is unsafe because it removes minerals, but if it meets safety standards, it's perfectly fine. High mineral content, or TDS, doesn't always mean healthier water. And taste. It's not a reliable way to judge water quality. Lab tests and risk assessments are what really matter. Finally, RO systems need regular maintenance. It's not something you can just set and forget. To wrap up, the WHO guidelines focus on protecting public health through a risk-based framework, not by pushing one specific treatment. Reverse osmosis is a powerful tool for reducing a wide range of contaminants, from heavy metals to nitrates, when chosen carefully based on water quality and risk. But safe drinking water isn't just about treatment. It relies on ongoing maintenance, monitoring, and strong water safety plans. When managed properly and meeting international standards, RO systems deliver safe, high-quality water for the long haul. If you found this presentation helpful, please take a moment to like, share, and subscribe. Don't forget to turn on notifications so you won't miss future videos. We're covering important topics like reverse osmosis technology, drinking water guidelines, water safety plans, and much more. Together, we can stay informed about public health, environmental engineering, and quality assurance. Thanks for being part of this journey toward safer, cleaner water for everyone. Thanks for joining me today. If you want to dive deeper or have any questions, don't hesitate to reach out. I'm here to help. Until next time, take care and thank you for your attention. This video was created with SlideSpeak. Visit SlideSpeak to turn your presentations into engaging AI-narrated videos.